Every day, the discharge facilitators support the wards to ensure safe and timely patient discharges and transfers of care, including moving patients, taking bloods, and anything else required to get the patients home safely.
This morning, this is the board round we have on every ward in the morning, where the doctor in charge, the consultant, will discuss every patient on the ward, decide if they need any investigations, whether or not they are fit enough to go home, and the discharge facilitators will then ring around, see if they need package of care, make sure they've got all the documentation, all the medications to go home with, ring the family, inform them in case they want to come and pick them up. Normally we take them down to, we have a discharge lounge where they get transported home if they don't have any transport, which is on the other side of the hospital. It's a bit of a run around, but keeps your legs fit.
Prior to them, obviously, we'd have a bay of patients and we'd have to sort out the discharges for all those patients ourselves. Since we've had the role, it's so much easier. So they come in at board round, they'll listen to what discharges we have that day, and you kind of know you can leave them to it to an extent to sort it out. So they will speak to relatives, they'll order medications, book transport. A lot of our patients go to nursing homes as well, so they'll liaise with the homes, which means we don't have to do that. It just takes off a lot of pressure, because although it doesn't sound a lot, when you've got 8 or 12 patients and you've got, say, 3 or 4 discharges, it's a lot of time. So it's really helped in that way.
On some of the wards, communication with patients can be difficult. The discharge facilitators make sure the channels of communication are clear between the consultants, nurses, patients and their family.
Are they in a key safe, do you know?
Yes, got them.
Right, do you want me to give your granddaughter a ring then?
Yeah? Be well.
Basically, this is a ward where you'd come and you're ready for discharge to go home, and we'd get all your information ready, all your discharge summary, your TTOs, and then you'd be ready to try and get you home. But sometimes it's a bit hard, because obviously we get breakdown in communication, and the discharge summaries we have to chase, but we get them done in the end.
So we've just dropped some TTOs off at pharmacy. What happens in the morning is the pharmacist comes to the ward, they'll clinically check them and see what the patient needs to go home, and she'll then give it to us and we run it down to pharmacy. Previously there was no one to do that, so you were waiting for a messenger to come pick it up, or a member of staff having to leave the ward to do that. What we do now is we take it down ourselves one by one. We can go to pharmacy maybe up to 10, 12 times a day doing that. We also write on the summary, ring when ready. So when the medication's ready, they'll phone us and we'll come and pick it up. And it's cut down waiting times.
They really have been a breath of fresh air on the ward and really help the flow of patients run smoothly. And they all, well, in our particular case, we have a really excellent discharge coordinator who does his job with a smile every day. So it actually gives the whole team a lift, I would say, and helps us to do all our jobs much more efficiently.
I think it's an absolutely amazing role what they do. It's a great help to me because I cover quite a numerous of wards. So to save my time and help the patient to be discharged from the hospital a lot quicker is an absolutely amazing idea. I think it's absolutely brilliant.
It's time for Laura to go home after a long stay in hospital. The discharge facilitator gets to deliver the good news to the patient before sorting out the important details to get her home.
I'm looking forward to going home actually. I've missed my son quite a bit and it's been a scary experience coming in hospital, but everybody's been lovely and they've looked after me really well, so I can't wait to leave now.
And how have the discharge facilitators been with you?
She's been wonderful and she couldn't help me enough really. Give me all the tips that I need to when I leave. She's going to get all my medication sorted and I just can't wait to go really.